Good morning. You are welcome to Health Guide. My name is Dr. AbdulMujeeb. Again, understanding menses. Understanding menses now, women. They visit the clinic regularly. They're always there. They care so much about themselves, unlike men who care less. And because of this, they have a lot of questions to ask. So we're coming on board to actually relieve our women of these answers to a lot of questions that bother them in their minds. Today, we are looking at what is the color of what you lose in terms of how do you determine if you're actually doing well or there's a danger ahead of you. A normal person that actually loses blood, while we discuss the quantity, you're going to lose more quantity in the early part of menstrual flow between the first and second day, while other days begin to go down because it's a shearing away of a surface layer of the womb. So once you shear off this first layer, by second layer, the large volume of blood will have been out. So what follows eventually will now become a quantity that's manageable. Again, we have also discussed about tampons. Remember, how long can you actually wear a tampon for a normal healthy woman? It's not until it gets soaked before you get it out. The standard is between 4 to 6 hours. You should get out a tampon, whether it is soaked or not. You do not wait until a tampon is soaked fully before it's out. So all of this must be stated clear so as to live a good life. Now, the color of what comes out in the early part will look very red and bright red. You will see a bright redness, and that confirms to you that that is the early stage of menstrual flow. Towards the end, it becomes a darker red. That tells you that it's almost going away. So these are classical information you need to have at mind. So, and that's what we also tell you about regarding the cycle. If you understand your cycle, that the interval, the number of days in between your period, that's what we refer to as cycle. You must be able to know when are you expecting, how many days is going to flow, and at what time is it going to stop. So by the time you do 3-month consecutive monitor as a young girl growing or someone who's having an issue, when you're going to meet your doctor, you need to have a 3-month handy information. And that's what you can tell your doctor, the trend, what happened in 3 months, and can guide you on what to do. Sometimes there's no need to fear. It is just your configuration. But sometimes you need to be worried because your system is already going bad. So until we come your way again, we are still discussing understanding menses. You can reach us on 0802 3311 868. Thank you for listening.